All right. Wow. What a turnout. So I'm Todd Kerensky, and I'm the president of MASAM. I want to welcome you to the Pearls for Practice. We're very excited to be back in person, and we're glad you're here. I hope everyone has a wonderful conference. During the course of today and tomorrow, please take a minute to get to know your neighbor, the members of the board, and our sponsors outside. We value your involvement and membership. This is the first time we're offering a pre-course titled Modern Methadone Treatment, which is co-sponsored by the Bureau of Substance Addiction Services, or BSAS, and the Graykin Center for Addiction at Boston Medical Center. I want to deeply thank BSAS and Graykin for their leadership and support in making today possible. I also want to thank the entire board of directors and Miguel Ock for their tireless and often thankless work sustaining MASAM and helping us achieve our mission, which is to, quote, provide a medium for clinicians and trainees with special interest in treating substance use disorders and addiction to meet and address issues of mutual interest. Today is the culmination of that mission. This pre-course doesn't happen without the board, committee members, and Miguel. Miguel, can you please stand? He's outside, but please thank him. Dr. Jim Baker, our president-elect, please stand. And Dr. Peter Friedman, the immediate past president. The truth is, when Ruth and Jess floated a methadone pre-course, I said, no way, we can't take that on this year. Well, here we are. I want to thank Dr. Ruth Potee, our treasurer, and Dr. Jessica Gray, our secretary, for their vision, advocacy, and resolve in making this pre-course possible. Stand up, stand up. Jess and Ruth, you are both incredible friends, doctors, and physician advocates. Thank you. Ruth, I know what you're thinking. I'm eating up valuable time. But from my perspective, which you only have to deal with for another 24 hours, is we can take a minute to recognize you and the work you've done advancing evidence-based methadone and reforming the complex web of methadone regulations. Your passion is inspiring. The work you are leading to modernize methadone treatment lies at the core of MASAM's purpose and goals. Since the moment you welcomed me, a full stranger, into the cab at the New Orleans airport, you've inspired me to be a better advocate and not accept the status quo. You are a valuable member of MASAM and the board. If we could only sprinkle your passion for common sense methadone to everyone here today. I can't wait. Okay, and last but certainly not least, Dr. Komaromy is the medical director of the Graykin Center for Addiction at Boston Medical Center and professor in the Division of General Internal Medicine at what I used to call the BU School of Medicine, but is now the Shobanian and Avedistian School of Medicine. It's a mouthful. Dr. Komaromy served on MASAM's National Board of Directors from 2017 through 2021. She is the vice president of ASAM's National Medical Education Committee, and in 2019, she received the ASAM's Educator of the Year Award. Dr. Komaromy's research has focused on health disparities and care for traditionally underserved populations, models of postgraduate education, and care for patients with SUD and complex health conditions. Miriam, it's been a pleasure working with you on Unified BMC and South Shore Health Graykin Center projects. I look forward to our continued work for years to come. It is truly my pleasure to give you Dr. Ruth Potee and Dr. Miriam Komaromy.
Hi, everyone. Really excited to have everybody in this room. And first of all, there are some people standing in the back. No standing allowed. There's tons of seats. So come make some friends, move on down, get a seat. There's seats up front. Plenty of room. We have in the house today people from Rhode Island, from Tennessee, from New York State, and some other states. What other states in the room outside of Massachusetts? Anybody I missed? Miriam's in that house. That's right. Do I have any New Hampshire in the house? Oh, come on. What? Colorado. Okay. But most importantly, we have Massachusetts in the house. And not only do we have Massachusetts in the house, I think I have representation from every licensed OTP in the house, which is the most important thing. And that's not a small matter because you guys, run methadone hours, which means you're normally up at 4 in the morning. And it means that possibly you had to get somebody to cover for you this morning, which is also no small task. I don't need to convince you guys about the power of methadone. Like, I'm not even going to waste a minute on that because you all have the privilege of using the most potent, powerful medicine that we have in the medical pharmacopoeia. For those of us that get to take care of patients every day, we know that methadone makes you better. It makes you healthier. It decreases chaos. It changes your life. It allows you to work. It allows you to take care of your kids. And with this miraculous medicine that we have had the ability to use in this country since the 1960s comes an enormous amount of both power and privilege, as those of us that run OTP can testify to. And one of the goals that we have here is to break down the silos, because we all are working in silos every single day. But secondly, it's to acknowledge that the most important thing about methadone is to get people to the right dose safely and quickly, and then to keep them on their dose every single day. In a world where people are dying and our numbers are not better in Massachusetts, everybody knows they got worse again last year. In a world where people are dying from fentanyl every day, we have this drug that prevents death. And so we have got to figure out new ways to make sure our people get their medicine. And we have to change the description of us running liquid handcuff clinics, because that's not working anymore. So my hope is that after this meeting today, you're going to go home and you're going to look at some of your policies and think, it's been a while since we rewrote our policy. We're working with some data that feels like it could be 5 years old or even 3 years old. We should be looking at what we're doing in our clinics to retain patients and save lives every single day. And my clinics can be doing a better job. All of our clinics can be doing a better job. This is a map of the United States. It's the most recent SAMHSA data on licensed OTPs. It's a little disingenuous because if you look at it, it looks as though Massachusetts has 110 licensed community-facing OTPs. We definitely don't have 110. But you got to remember that every time that SAMHSA and BSAS licenses an ATS unit, a withdrawal unit, a jail, the VA, any of those places, they fall under this category. Can I just ask, does anybody know how many methadone clinic, community-facing methadone clinics we have in the state of Massachusetts? What's the number, Jen? 55. Okay. We're a little state. 55 clinics is freaking awesome, to be honest with you. And when you look at Texas, which by the way has 98, the state of Florida, which has 119, and again, those are not community-facing methadone clinics. Those are just licensed programs, right? Our statistics on having available methadone in our state is likely, I didn't crush the numbers for all of the 49 states that have OTPs, but we are likely the best in the country. Part of being best in the country, though, is I am a proud Bay Stater. I was born here, I was raised here, I currently work and raise my family here. You know, Massachusetts is actually the best in lots of things. We most often are the best in public education. We're most often the best in public health. We most often consider ourselves to have the best hospitals, the highest availability of clinicians. We have the best addiction medicine fellowships in the entire country, as far as I'm concerned. And we're the most, oh, absolutely, Mike, absolutely the most humble. I'm going to just keep going along the humble. We have universal health care that pays for addiction services, and so many other states, particularly the 9 that didn't subscribe to the ACA, do not have that available. We are positioned to have the best quality addiction care and methadone delivery in the entire country. And at this point, at this moment, we need to model to the rest of the country how this could be done and how this should be done. Because I tell you, I work with other states around the country, and there's a lot of other states that are doing an appalling job. There's other states that are doing a pretty good job. We should not be doing a pretty good job, my friends. We need to kill this thing. We need to be saving lives every day by keeping people on the right dose of methadone, regardless of what happens to them. What do we have going in our favor is that every state, county facility in Massachusetts is required to provide access to all 3 of the medicines. They may not do inductions, not all of them, not yet. But if somebody walks into the Worcester County Jail and they're on methadone, they are kept on their methadone. And that is thanks to the Department of Justice and Greg Dorchak, a single human being who made that happen. So today's about breaking down silos. It's about us working together. It's about us knowing who the OTP is down the street. We don't have to agree with each other on everything. And in fact, I think today could be a little spicy, and that's okay. Like, that's okay. But I do think that we all need to get better at what we do. We need to understand exactly what the regs say and what they don't say, because many of us work in this world where we think that the rules say, and if none of it is true, like, go back and read the rules. The rules are actually not so rigid. It's that we have created our own rules and regulations and rigidity that get in the way of evidence-based, patient-centered, individualized treatment. And at the end of the day, that's what we need to be doing. I'm going to hand it over to Miriam, and then we're going to hand it right over to Dee Calvert, the head of BSAS.
Thanks, Ruth, and hi, everybody. I'm so excited to be here. I'm just going to speak very briefly. I really only want to show one content slide, just to remind everybody in the room that methadone is everywhere. Methadone is considered one of the 100 essential medications that should be available all over the world, and many, many countries around the world have methadone available. In the picture on the left is a methadone clinic in Hanoi, Vietnam. And you can see that there, just like here, people are on their cell phones. And those are mostly delivery drivers showing up for their morning dose. And then on the right is a mountain clinic in the far north of Thailand, near the Golden Triangle of opium production. And that's a mom with her baby, and she's coming in to get her methadone dose. And the medical providers there shared with me that she had had a healthy pregnancy and has a healthy baby girl. And I'll also point out that they have quite liberalized regulations around methadone. They're set up on a card table and handing it out in little cups right there. So it can be done, and it's life-saving, even in a less rigid, or perhaps even more in a less rigid treatment environment. So I think that's there are examples that we can aspire to from elsewhere in the world. I also wanted to mention that we tried hard to fit everything into today in terms of all the things we would love to talk about, but we weren't successful. And so the Graken Center and MASAM are going to be collaborating to offer an ongoing sort of virtual mini-series on methadone. Yeah, so you'll be hearing more about that, but you know, touching on things like how worried do we need to be about arrhythmias and the risk associated with higher dose methadone, split dosing as an important evidence-based treatment tool, and supporting healthy pregnancies. So we hope you'll join us for that. And with no further ado, let me welcome Dee Calvert to the stage to speak with us.